We are really excited today to bring together our stakeholders, our partners, researchers to really spark a wonderful conversation around our vision for the well-being economy and the future of health equity. We see this conference as a great opportunity to give us greater clarity on the vision moving forward. And so we're really excited about the community that's gathered here today and the kinds of ideas that will be generated.
I think it's in the very DNA of the University of Texas, and where IC Squared came from was the idea of gathering those different voices, different opinions, bring them into a space and then hashing out how to go forward.
I'm really excited that we are starting again an IC Squared tradition of a conference of experts coming together to inform us not only about what is going to be the trends, but how our research and how our thinking fits into those trends.
We know that there are certain locations, populations, whether it's from socioeconomic status, it's geographical, particularly in urban areas, racial or ethnic identities that are being seen, where the health impacts and all the great work that we're doing is still not being realized.
I mean, health equity's always been an urgent problem, right? A lot of people will tell you that COVID showed what everyone already knew behind the scenes. And so I think having these discussions is really important because health equity affects us all.
Health equity is that where you live or what you look like doesn't determine your health outcome.
We're taught in medicine to triage. The sicker they are, the more immediate you give them care and the more care that they're going to receive. We do not do that at all in healthcare. In fact, it's flipped, right? The funding for healthcare is totally flipped on its head for that. Patients who have the least resources, who face the most, discrimination, poverty, all the social determinants of health we've been talking about, end up having the least medical resources.
We know that the old ways are not working, so we have to push ourselves to think about new ways of delivering services to our priority populations.
Let's put our research skills to work for this community.
We just can't look at the health status outcomes for virtually any community in Texas and not ask the question about why these things exist. So I think the data force us to go upstream in our work.
We understand, right, the social determinants of health are important, but how they actually matter in the real world is something that we still need to gain greater clarity and understanding around. And so we're thinking about interesting techniques, novel techniques and data sets that might be able to give us greater precision in terms of how we understand the significance, the salience of social determinants of health in our world today.
What resonated throughout almost every presentation was this issue around trust, and that whatever you're trying to solve, whomever you're trying to work with, that you really don't have an opportunity to do that unless trust is the foundation of that. And in my opinion, that starts with people sitting at the table and having coffee and breaking bread and getting to know each other and understanding this is how I think about this, or this is my experience.
In what ways are we continuously pushing ourselves to learn, be introspective, and grow, understanding those that we're serving, but then also having the space for the community's voice to not only be heard, but to actually take heed to what the community is saying, to actually drive the direction in which we're going in health.
If we are to create a more equitable community, no one sector can do it alone, and we need all of us in this work together.
In the end, I'd say the one thing I would encourage us to do is to not set our sights too low. And so I want us to think of health not just as the absence of disease, but the true target of health being living a joyful, dignified, and fulfilling life.